What's up, everybody? We are live with Vida Health. It is the place that I get all of my peptides. I'm going to let them introduce themselves because they are fully functioning adults on peptides. We'll let Paul go first.
I'm Paul. I'm the owner of Vida, one of the owners, and I'm here with Katie, and she can introduce herself from there and what her position is.
Thanks for having us, Marco.
No problem.
So my name is Katie. I'm a nurse practitioner at Vida Health and Wellness. We specialize in all things wellness, so optimizing hormones, peptide therapy, aesthetics. So we're here today just to talk about what Marco's been dabbling into and just give you guys some information on how to better your life.
So I think a lot of the hesitation with peptides is how do I get started? I think that what people need to understand is it's not that scary.
For sure.
So I'm going to have Paul talk about this. Paul, when you're saying, hey, come in, you want to start peptides, come in, explain, and might not even need to come in. They could do a phone consultation even.
Correct.
Can you give us an idea how that goes?
Yeah, so they can either do a phone consult with us, they can come into the office and do a consult with Katie. It's very simple, it's painless. We don't require blood work for peptides. We recommend blood work so you can figure out if your hormones are optimized, because that's a big thing that most people, if they're lacking something, it's usually a hormone issue, and then we can stack peptides on top of that to even optimize them better.
I love blood work, though. For me, I love tracking where I'm at.
Definitely.
I love seeing, because when I first started testosterone, I felt like I was almost too high. I was a little bit irritable. I was a little quick triggered.
That's that estrogen.
Yeah, and
yes.
so I now take a pill to stop the estrogen.
Exactly.
So,
correct.
And it's been great for me because it balances everything else out. So I don't have any negative side effects to my testosterone.
So
I'm a big advocate for blood work. I mean, if I would have done my blood work when I was younger, I almost died, you know. And if I would have done my labs consistently, as you should, I would have caught all those negative things that was going on with my body, and I could have saved all the issues that I had coming without doing blood work.
Because you had to get a kidney replacement.
I had to get a kidney transplant.
Exactly.
And that was lack of blood work because I never did my blood work because I was young and I thought, hey, I'm invisible.
The ego men have about actually taking care of themselves is kind of crazy, right? Like your wives or your girlfriends or even some of your friends, they're doing everything necessary to stop or slow their progression of age. And I think it's important. And that's why I got so aggressive with you guys. I'm like, yo, I need to be on like a regimen. I need to make sure I'm doing the right things. And that's kind of where you come in.
Yep.
Because you've helped kind of guide me in what direction, like, okay, what are you trying to do? And then you've guided me in that right direction. So when you talk to someone, are you trying to get an idea of their life or what they're trying to accomplish? Can you explain that?
Yes, it's a great question. You guys have both mentioned something about the word balance. So while we're working on people's health, that's really what we're aiming for is just balance optimization. So everybody's consultation looks completely different, but that's really how we start. And many people are intimidated by the word consultation, but just think of it as a quick conversation with a medical practitioner who's going to get you exactly what you need by just a quick conversation. So like you said, Marco, you came in telling us exactly what was wrong, how you were feeling, what you were looking to improve. Everybody has health goals. So once we talk about that, then we could talk about how the treatment plan is going to be gauged for you and give you that individualized care that you're looking for.
And what's so wild is there's a peptide almost for everything.
This is our key phrase. We went viral on TikTok
viral thing,
for this.
Katie, there's a peptide for everything and it blows up. And then you get people like, well, there's a peptide for this, which obviously is not a peptide for everything, but they're almost.
But there's a peptide for anxiety.
Yep.
There is actually more peptides than anybody even knows. There's thousands of peptides.
There's peptides for sexual function.
Yep.
I know a lot of my friends need that. They're struggling in the bedroom, you know.
And that is a really good one. You know, even insulin is a peptide. So peptides have been around for so long.
Hormone.
Exactly.
It's everything.
They've been around. So people are acting like this is like a new thing, like a buzzword, like a peptide. Everyone wants to be on them. We've had peptides around for hundreds of years. So everybody is just kind of getting into the use of all the new ones, like you mentioned.
Correct.
There are so many fun peptides now, but just think of it really as medicine, supplementation that's been around for a long time, but now we're finally using it for what we need it for.
I think what's been frustrating for me is like, I'm like, you know that guy at work that just brings up stuff randomly? I'm like, you're not sleeping good? What are you doing? Like, are you on a peptide? Or I'm always trying to find a solution with stuff like this.
Yes.
Do you think that there's a great way for people to look up like, okay, I know that I have this problem, but I'm not 100% ready to reach out to the people to set it up. But almost like a chart that could tell them, is that something you guys can get on your website to show people hey, here's one for sleep. Here's one for sexual function. Here's one for energy. Here's one for brain clarity. I feel like if you had a chart that was idiot proof for people to look at, I think that people would be more.
So yes, we have something super similar to that. It's involved in our consultation process where you're filling out a form with what you're lacking in. So what you're looking for literally says do you experience brain fog during during the day? Do you experience low libido? So it's like a questionnaire that helps guide us to giving you a peptide that's perfect for our patients. So all of that hard work where you're going to have to think you have to come in and you have to talk about yourself, what you're deficient in, it's kind of taken off your plate because we're actually, aiming our conversation to what we think that you'll be needing by this questionnaire.
That makes sense.
So you don't have to come to us, telling us like all of these embarrassing problems, things people don't really want to talk about. We have questionnaires and surveys where we're kind of like trying to figure out what's going on. And then of course, like we mentioned, through blood work, through our conversation, we're definitely going to be able to find our patients what they need, what they're looking for.
I think the biggest one of men, and you might know, like you said, a lot of your friends need the sexual ones. Men are embarrassed to tell, especially Katie, a female. I get all the time where they'll pull me aside and say, "Hey, listen,
Hey, cuz, hey,
like I want
behind the door.
Oh, I've been struggling, but I want to tell Blondie."
And I'm like, "Hey, listen, this is a thing that you have to like. She's your provider.
Yeah.
You can't tell me. I mean, hey, I can go in there and say, hey, listen, they're having this problem." But you have to go talk to her.
You just have to be open and honest with your
Katie
practitioner.
Doesn't judge. We don't judge. We don't care. We see it all day long, all kinds of crazy stuff. Trust me, that's the least amount of crazy we see.
We want to know these problems.
Yeah,
exactly.
I want to know what my friends are going through.
I always said, I'm 5'8", I have no ego, and neither should you. I believe that this world is so unique because it can be tailored for everybody.
Totally.
And it's not like, it's not just like, go to the gym and you're going to do bench and you're going to do back and you're going to listen. Yeah, you should work out when you're on peptides. To give you a little bit of glimpse into my life, I wake up every day around 8 o'clock. Some days it's 7, some days it's 9, but around that range, I head straight to the gym. I get a full 30 minutes on the Stairmaster, and then I do a full muscle group, whether it's legs, shoulders, back, arms, chest. I do everything. I double up once a week on another muscle group. But what I'm trying to say is I have the energy now where I used to drag myself to the gym, where now I get up and I'm like, ready to hit the gym. Mm-hmm. And I think that needs to be like, people need to understand when I'm 36, when I first ran my blood work, I was in the high 300s for testosterone.
Total testosterone.
By the way, having sex 5 days a week. So like
some people can function good on a 300.
We see people that I always say, we get a lot of older guys that'll say, that are like 50, 60, like, I don't have a problem. I have sex 4 days a week. I don't have any, I go, it doesn't mean anything. It's not even you can't even look at that because maybe you think your libido is great, you're having great sex, but now let's optimize your hormones. Oh, wow, my erection's better. Everything. Exactly.
Bigger, better,
everything.
Yeah.
It's that you can think that you're fine. I'm fine. 98% of men, 99 over 40 are on the low end. I think we've had 2 people ever test like normal.
Yeah.
It's a real aging issue. HGH, testosterone, everything is going down. That's why peptides and testosterone
You just said something that's such a trigger for me. Think about all the processed shit that we eat and we put on our bodies every day. 50 years ago, there wasn't that much in our bodies. You weren't using like shit soaps. You weren't using bottled water. Yeah. That's why I switched to glass bottles because I'm a psycho.
Yes. Clinical data has literally shown that men's decline in testosterone over the last 50 to 60 years has just gone down, almost doubled in quickness because of all the garbage that we're putting in our bodies. It affects our hormones. It affects the way we function. Like you guys mentioned, you may feel good on a low number like that, but can you feel better? And that's really what we're looking for. So just like Marco was talking about, he's like a perfect patient for this. So he was functioning well. He thought he was healthy, thought he was good, but he was aiming for more. So that's exactly what he did. Coming into the office, getting blood work, getting yourself on supplementations, on peptides, and just going for your goals and making yourself like the healthiest version of you is all we want to do as practitioners. Just make our patients feel the best.
I love that. Actually, I remember the first time I ran my testosterone, I was like, I'll be fine. I'm a dude, it'll be fine. And then when I saw it, I was like, oh shit. Like, I was like, I was almost like, I wasn't bothered. I was more like in shock.
Yes.
And I think people would be shocked if they ran their blood work and they went through the rigmarole of doing this. Like, it's not a big thing. Like,
you have to drop the ego, like you said.
Put your ego aside, come in, and then like, you'll see, I get more compliments now than I've ever gotten in my life. I'm in the best shape of my life. I'm 190. I bet you my body fat percentage is around 15%, maybe a little less. Yeah. But I eat like shit. Mm-hmm. I eat everything I want, and I do whatever I want. I eat cookies. Mm-hmm. But I'm in great shape.
So it's key what you were talking about, like hitting the gym in the morning, having a regimen, getting a routine, and then using like the peptide therapy just as like a little aid. I like to say, like, get yourself going on it, and then get those lifestyle changes and just make that change. So just like Marco was saying, walking into into the office, I know a lot of people are going to ask him like what peptides he's on and what he does that makes him feel so good. Do you mind sharing with everybody which ones we started you on?
So currently I'm on GHKU for hair, skin, and nails.
Yes.
And skin, right?
Yes.
Yeah. That's
it's that glow. Yeah.
I want to be beautiful. I want to glow.
This is big on men too. Like it's not just the females in this aesthetic peptide industry.
Face cream. There's a whole line of GHK. It's not just injections.
And we talked about the male population really diving deep into this lately too.
We have a couple of young people that are like young college kids are like, it's huge in college right now.
Yeah.
Everybody's on GHK.
They want that glow.
Well, I believe that if you look good, you feel good, you perform good.
Yep.
So if you're in your job and you're like, man, I get there and I feel tired and I'm lazy, I'm not saying you need to go put on the crazy amount of, like, I'm not saying you need to do a ton of shots. By the way, with that being said, I want to sidetrack. Peptides aren't 100 different shots. You're able to draw them up into one small, like, how big's the needle? It's small. It's
a baby insulin
It's
needle.
a baby insulin needle. It's literally, it's like pinching yourself and you're done. Like, I literally do it like in 5 seconds and I don't blink an eye.
But there's also the trochets now.
Different routes. So many different routes.
Which aren't as good. Obviously, the bioavailability is about 75% less. But for people that are so scared I can't do the needle, I'll pass out. There is other options.
The best part about this too, though, is just coming into the clinic.
Exactly.
We will teach you how to give your injection. We will teach you how simple it is to draw it up.
My always joke was I could walk by you and inject you.
You won't even know.
You wouldn't even know I did it. It's that needle's so small. You don't feel it.
Because especially if you're in a bumped in area, you're like, oh, what the hell was that? Like you wouldn't even know, like you got stuck.
No.
And I that's why I wanted to sidetrack is you're like, oh my God, I can't just do the shot. It's not like it's a fucking huge needle.
Not
It's
at all.
so much simpler than that.
Yeah.
It is.
And I hate the stigma that people are starting to make fun of peptides a little bit because it's getting so popular.
Too much of a buzzword.
And I keep laughing. I'm always like, you say that, but like you want to optimize and you want to extend your life as long as possible.
Well,
and
the stigma has always been needles.
Yep, exactly. It's not a
joke. Is you're a drug? They're the drug addicts. You know, it's a needle. They're
the needle thing.
First off, it's not even going into a vein or anything. So it's a total. It's just a stigma.
Or the old school parents. They'll be, you're on steroids? I'm like, yeah, Dad, it's testosterone. Testosterone, steroids, buddy. No, it's a natural thing in your body.
Exactly.
I am so passionate about that because I have an Italian mother that was like this. You're on fucking steroids. I knew it. And she's like, I've noticed you're looking a little too big. And I'm like, Mom, I'm literally like, I'm taking care of myself because I'm half Greek and I'm half Italian. And my Greek side is not aging very good, but my Italian side is. So with that being said, I'm countering my Greek side by doing testosterone and I keep my testosterone levels between 800 and 900.
Perfect.
I know a lot of guys that like to be over 1,000. I don't. I'm already a psychopath. I don't need the extra
800 or 900 is a perfect goal. That's what I tell all my patients. Like, this is the number you want to be at. You know, you're not like going through the roof on crazy high levels. Your estrogen's usually going to be balanced there too. Hemoglobin, hematocrit, not getting too thick. So it's just a perfect number. 800 or 900, I always say is a great goal.
I think 1,200 is the cutoff because then after that you start to get cardiac issues.
Yeah.
There's a lot of other issues that come in play when you get too high. And I've seen crazy numbers. Like we have bodybuilders come do blood work and I'm like, what was mine back in the day?
What are the bodybuilders coming in at?
6,000.
That's crazy.
Yeah.
Yeah, I've seen 7,000.
That's crazy.
Marco, look at what do you think mine was back in the day? 6,000, 7,000.
Well, you know what? That's overuse, right?
That's where you get your health problems. Like when you see a guy that's testosterone is 7,000, everything is red marked. There's nothing normal on that thing.
So those are not our patients.
Those aren't our patients, but we do a lot of bodybuilders that come in from Greg, clients, and we'll run their labs for them
because they check safety.
To check to see, make sure. And some of these guys, you're just like, hey, you need to go.
You're also telling them, hey, I'm sure that you might be performing great, but you are hurting your body, which is great because someone needs to tell them.
Totally. Correct. And then we're just going to be chasing that high hematocrit on most of our patients. So that's why there's strict protocols. And that's why the best thing to do is to do this through a medical provider, somebody who knows what they're doing, can go through your labs with you. You know, we talk about different peptides being available from like online places, China, like all these crazy places where people are like, well, why would I go to you guys if I could just order BPC online from China
for a quarter of the price? But there's listen, our pharmacies are real pharmacies that are.
Why don't you let me bring this up?
Okay, bring it up, Marco. Go ahead. Let's see.
I have a lot of friends that have. I have a great friend of mine who's like, "Yep, I got you these peptides, but I have to mix them, and I have to." And I trust it. Like he sent it to a pharmacy. The purity's good. I don't want to mix it. I want it to come in the mail. I want to open the bottle. I want to draw it up, and I want to be done.
Yeah.
So with that being said, is there places to find it cheaper? Sure. But you'll have no consultation, you'll have no guidance, and you'll have no roadmap. It's like saying, hey, I'm going to college to get a degree, but you don't know how to get the degree. Like there's no one there to teach you. Now, mind you, most touch. Or you know what? I'm gonna say this. It's like going to get a union job, but you don't know how to do the job the union's hiring you for. You're like, well, I don't know how to put the electrical box back together.
Yeah.
Well, you had someone there to teach you. That's what you're gonna do.
Definitely.
You're gonna guide us in the direction to like fix the problem.
For sure. So
or get better.
This is probably like the most asked question I get in the office. Why should we go to you over online? You know, people are price checking and just confused on where to go. So I always explain, peptides are a medical procedure. So you want to go to somebody where you can actually get the correct one for you, somebody who can go over dosage with you, somebody who can teach you how to draw it up, how to store it, how many units to give yourself. We take all that hard stuff away from you and we do it ourselves. There'll be no questions when you leave. You know, a lot of people are like, even on the wrong dosages. We've been seeing a lot of our patients coming in saying they've been taking testosterone at crazy doses and they never got any guidance on it. So we really take that away, make it easy. Like for you, Marco. They don't know how to mix
it. They don't know the right MLs. That's the problem.
Yes.
And here's the other issue. And I'm going to say, I'm not going to say there are some good websites out there with lipolyzed powder peptides, right? But here's the issue when you run into what we have real pharmacies that we have a really good 2 pharmacies that we get peptides from that they test every single batch. Now, when you say every batch, if they make 1,000 bottles of, let's just say BPC, it's already liquid, right? It's not being, you don't have to premix it. They test that whole batch for sterility. It's made in a clean environment, air environment. When you're getting these other peptides, the purity might be good, right? But that you don't know the sterility of it, all right? And they might test one peptide, right? Okay, and then they get, for the next 2 years, they're using that same COA report.
You don't know if it's sterile.
You don't know if it's sterile. You really don't. You don't know what you're getting. And I'm not going to, so there's some good online sources. I'm not going to knock it.
But it's like,
but you're playing the Russian roulette.
For sure.
Okay?
For sure.
For real.
And you're injecting yourself
this is your
with
health.
this.
And you can go, you don't even know what you're getting. Some of these places, there's not even real stuff in them.
Yeah.
Plus the dosing, people don't even know how to mix this and dose it right. And then they're putting, we had a couple patients come by us with their stuff like, oh, I got this online. How do you, and I go, throw that out. It says the bottle's BAC. It says BAC on a backwater. It's a little vial that it was homemade. Like that's not backwater. Bacterial water comes from Hospira. It's a prescription.
Actual labeled
on it. Not that, you're putting that in your body. You don't know what's in that water. What you could be sick tomorrow. Like, where this can cause your you don't know, kidneys and liver and all that.
So this is the biggest thing. It's just safety with this stuff. Correct. So we want to take that stress away from all of our patients. We want to take the headache and the hard work away. Just like you said, people don't want to go home. They're not chemists. They don't know how to mix it up. We do all of that. So we are going to teach our patients exactly what to do, how many units to give themselves, how often, how to store it, when it's expired. We take all the hard work away and we make sure we're doing it in a safe way. That's our main priority, is to make you feel safe, make you feel as best as you can. So we're going to do it, the safe way, exactly how people want it.
I love that. So I think a big thing that people might need help with, and I've noticed this over even in like the career I'm in, which is the automotive business, a lot of guys struggle with sleep.
Yeah.
So we talk about, your health or, your testosterone, or let's talk about sleep.
Sleep's huge.
So what peptide or what peptides have you prescribed for
let's
sleep?
Let's go back real quick. Same subject, but sleep. So I'd say most of the guys we know, this is a fact, the medical truth. Sleep apnea is the number one issue that men have.
Yeah.
Okay. If you have a neck bigger than 17.5 inches, you're 99% of men or anybody have sleep apnea. And what we see with a lot of our patients is that makes their blood thick. And that's like the number one thing that increases your thick for your blood. It's not the testosterone, obviously that increase it, but it's sleep apnea.
And that blood not getting circulated.
Like the key, like we tell everybody, you need to get that fixed first, because you can take all the peptides you want and you can take every precaution to make you sleep. NyQuil, you're still not sleeping. You're not getting
And a great way to thin your blood is to go donate blood.
Donate blood, but to fix your sleep apnea.
Well, yeah, that for sure.
Because if you fix that, it's everything. Your blood pressure goes down, your thickness of your blood goes down. But there also is great peptides to sleep. Let's say you're optimal and you got your sleep, you're still not sleeping. There is any growth hormone peptide is going to help you sleep. It puts you in a deeper REM sleep, just like taking HGH, right? It's going to put your body into that deep sleep so your body recovers, your hormones optimize while you're sleeping, your HGH goes up. That's why you take these peptides, HGH ones, at night before you go to bed, because they really do knock you out. Like I have wild dreams on HGH peptides.
Yeah,
Like, I tell Katie, I'm like, dude, you don't even want, my dreams last night were wild. Wild, Marco.
Maybe you want wild dreams.
I'm running through the forest and there's bobcats chasing me, ex-wives, ex-girlfriends.
But he's
my
getting
wife,
good sleep.
I'm like, this is wild. I wake
But
up
he's
like,
getting good sleep.
you know? Thank God it wasn't real.
Yeah.
But just like you said, Paul, those peptides are giving you that HGH component, so it's going to help your hormones just kind of optimize overnight, and then it's also going to help the HGH. So overall, that's like a calming, hormone that's just going to help you be able to relax. But there are peptides that are significantly proven just to help sleep, like DSIP, epithalin,
and that resets your mitochondria. So it's not a peptide you take all the time. It's like a 10-day phase of it. You blast it for 10 days, and that helps too. There's mixed results on it.
Or DS, whatever that's what it's called. I've heard that one.
Yeah.
That's one that you could just, let's say you're having hey, I need to get to bed tonight and I really need good sleep. That's something you could just hit on the random.
Well, it's supposed to be ran for 10 days, cycles of it. So and then it resets your mitochondria. It's something you don't run all the time, right?
Got it. So if you did it like once a week, it's probably not going to get
not going to do great. You need to run that, and then it helps you reset. Like if you're really like, hey, I need to sleep tonight. I'm not kidding. If I take a CJC Ipermelon, I am knocked out.
That HGH in it.
It's even if it's one time. I mean, obviously the longer you take it, it becomes more consistent in your body and blood, but man, it knocks me out, Marco. It's just
definitely.
And you have the wild dreams,
Sleep is probably one of the most requested problems people are trying to fix. And then also people with inflammation. So just like joint pain, feeling bloated,
and
feeling inflamed.
What do you get for that?
BPC 157 with TB 500 or the Wolverine stack, just that combo in general is going to definitely help inflammation, helps patients just feel less bloated, just overall less pain. It's called the healing peptides.
And this is for men and women.
Definitely. Correct. Yeah, it's great for women as well. Another thing about that is women kind of get scared about these, intimidating peptides, but they're for women too. So we always say this is dual.
For sure.
I'm going to just bring this up and I my wife will verify this. Testosterone, women need it too.
Yep.
Huge.
And my wife got pellets. She did the testosterone pellets instead of the injection.
Yep. Yeah.
I will tell you, when she was on those pellets, it was the best sexual experiences of my life with my wife.
Definitely, because testosterone controls that.
Because you're optimizing your hormones.
She was more ready. She was more excited. She was the one initiating.
Definitely.
And I think what you have to realize is I get that, like, you're like, oh, it's my wife, things aren't, it could be a hormonal issue. It might not even be like the connection's lost between you two.
It could be hormones.
I want to just say, hey, have your wife check this stuff out too.
All we have to say about that is the female population is underserved and just underdiagnosed. So just as men, our testosterone declines with age. So going in and getting your hormones checked, you will not regret it. And
we also have a lot of women that are like, oh, I'm against hormones. It causes cancer and I'm not doing it. And I'm like, you are all
of that has been proven.
This has all been proven incorrect.
Exactly.
And it was a scare tactic. And now they're just coming out now like that.
It's safe. Estrogen's safe. Testosterone's safe.
Hey, my bad. I was wrong. I'm telling you.
Yes.
Like my mom used to tell me when I was young, you're allergic to cocaine. And I grew up my whole life thinking I was allergic to cocaine. So I'd be like, hey, no, I'm actually allergic. She brainwashed me. Your parents brainwashed you. Yes. Don't be brainwashed by your parents. Go talk to a Katie.
Yes, this is what Big Pharma is doing. They're scaring everybody away from all of this. This is why peptides have been hard to get, why people have been asking us, like, how do I get this one? How do I get that one? Big Pharma is trying to shut them down because we're treating the root cause of people's illnesses with peptide therapy, and they're intimidated by it.
Do you think the government or Big Pharma wants you healthy?
Absolutely not.
The answer is no. The healthcare system is everything in this world.
They want to keep treating.
They want to keep treating you. They want to keep the money coming in.
Take some more pills.
Hey, you're fine. Take this pill. Like,
treat the symptoms.
There's literally something. Isn't there a pill to help your immune? Or not a pill? Maybe it's a pill too. There's a peptide for your
thymosin alpha-1.
Yes.
Which is amazing for immunity.
Excellent. Yeah.
So what does that do?
Everyone should be on that one right now with like respiratory diseases going on right now. Everyone needs to be on this. Literally, it just gives your body exactly all of the nutrients, minerals it's deficient of, and just helps keep away illness. So this one is key for people who have like chronic sicknesses, chronic illnesses. People are on this one and loving it.
Or your kids are in school and they bring you home all the germs.
Everyone's sick right now. Exactly.
Everybody.
Yeah, it's a no-brainer. I really do believe in that.
So what other peptides are you on, Marco?
So I'm on testosterone.
Okay.
I'm on the Wolverine stack, which is the BPC and the TB 500.
Perfect. Yes.
I am on what's the last one? I told you the GHKCU.
Yep.
And that's testosterone. That's really the 4.
That's perfect.
That's the 4 that I'm
You were
on.
on IGF before though.
So I was told that you should cycle IGF every 3 to 4 months.
That's what I told you.
Yeah. You did help me with that.
So Marco's a great patient who's just kind of gotten into peptides and hormones slowly and then just started stacking them. So this is key too for people who want to start on them. You don't have to go off with everything out of the gate, but just starting on a couple. I think BPC is, like we always say, like the gateway peptide. Just starting on a peptide and then just kind of going from there, figuring out what you need, what's best for you, and then they're compatible with each other. Like there's
TB500 actually helps with not getting sick. Helps your immunity. I'm not allowed to take TB500.
Oh, because
my kidney, because
transplant.
it can cause my body to become too, actually, and I was on it, and my doctor's like, hey, I don't know what you're doing, but you're immune. I did immune system tests. I didn't know they did that. And I was like middle, like, what you're supposed to be.
Oh.
She's like, you need to, so they upped to my medicine. I'm like, oh shit, I got to come off TB500.
Yeah.
So you don't think about things like that. Like, yeah, that's why it's great to come to us, because what if I'm
Blood
some guy
work
on the street and I had a kidney, I'm going to take all these peptides. There's no interest. Well, guess what? There is some people that can't take things, right?
Yeah.
I can take a lot of them, but I do my blood work every 3 months, okay, at Loyola. And then Katie just did my blood work yesterday. I think. Yeah. So I do mine at Vida. Probably, it's nice because I can do whenever I want. So if I feel off, I'm like, hey, Katie, can you do my blood work?
Let's do this.
Which is awesome for me because it would have saved my life back then. That's why I tell everybody, hey, listen, your insurance paid for it. The stick is so little. Come do your blood work.
So easy.
And then we can see what is going on.
Yeah.
You can catch the littlest thing and catch it,
Yeah. So everyone's scared of blood work. Everybody's scared to do the needles, but it's really not that bad. I mean, once you do it the first time, you're going to be like, that was it. Everyone says that. And the payoff of it is so much more beneficial than a little prick. Everyone gets over it. So just come get your blood work done.
It's just a little prick. As we round things up or end things, the question I have for you is so you have a website.
Correct.
What's that website?
VidaHealthSpa.com.
VidaHealthSpa.com. And I will vouch for this, and I'm going to say this very passionately. I've been to different places to get peptides. The best prices that I have gotten have been with Paul. And the best part is you get her who guides you in the right direction. She makes sure you're okay. And I have to tell you, this will be the best decision you ever made. Your spouse will like you more. You'll be in a better mood. Your kids will love you more because you'll have more energy. Your family might like you more because you're going to be like, wow, this is the guy I knew or the woman I knew. I think it's so important to be the best version of yourself. And if you're the type of person that's like, well, I want to be the best version of myself, which I think everybody should be, the best place to go is, say it out loud. Say it.
Vida Health Spa.
There we go. Thank you guys. We appreciate you.
Thanks for having us, Marco. We love
Until
you.
next time.
Thank you guys. Come visit.